Alright, this is Joe, and this is joints of the lower quadrant. I'm going to start with the hip. The hip is located, if you find the femur, the greater trochanter of the femur, it's located between that and the pubic symphysis, kind of deep in our leg. The motions of, the other bone at play here is the pelvis, so it's the pelvis and the femur. The motions here are flexion, extension, abduction, adduction, and external and internal rotation. Next is the tibiofemoral joint, or the knee joint. This is easy to find here. So if you follow your femur down to your kneecap, your tibia is kind of the more prominent bone in your lower leg. Follow those two to the joint. You can feel the joint line on either side, just below the epicondyles of the femur, and there's the patella on top. It's kind of a giveaway. The movement of your knee joint would be knee flexion and extension. Let's see, next is the tibio-fibular joint. There's 2 points where these 2 bones meet, the tibia and the fibula. There's the proximal portion, which you can find by kind of sandwich gripping the fibula just below the joint line of the knee. And this portion of the proximal tibio-fibular joint is responsible in part for plantar flexion and dorsiflexion, and then down by the floor, let's see, if you find the distal tibio-fibular joint, if you find the lateral malleolus and follow it up, you can actually feel where there's a spot where it meets the tibia, and there's a little notch there called the fibular notch. And this portion, this joint is more responsible for inversion and eversion. Okay, and then what? Then there's the talocrural joint, or the ankle joint. This joint involves the tibia, the fibula, and the talus. Again, it's easy to find the malleoli, I guess you'd call them, on either side of the talus, and you can palpate the talus just in the notch at the top of the foot. This joint, the motions here are plantar flexion, dorsiflexion, and then eversion and inversion. I don't think I missed anything, but maybe I did.